Pregnancy is hard for many moms. Fatigue, nausea, vomiting. But sometimes it's not just morning sickness, it's much, much worse. Some women are sick more than 60 times a day, month after month, sometimes right up to delivery. That's hyperemesis gravidarum, or HG for short, a serious, potentially life-threatening condition. And yet, many doctors don't understand it. They tell women it's normal, it'll pass, or even it's all in your head. But HG is real, it's serious, and it's not just morning sickness. In fact, HG accounts for hundreds of thousands of hospital visits a year, and recent research finds that there's a genetic component, which means it may plague a family for generations to come. Imagine months of extreme nausea and vomiting. It's hard to eat or even drink water, leading to malnutrition and dehydration, weakness and fatigue. Some patients lose 15% or more of their body weight. Their lives and their babies are at risk. And HG can also affect their emotional and mental health, leading to depression, anxiety, even PTSD. More than 60% of these patients will lose their jobs. Most struggle to take care of their families or even themselves. Many feel isolated and alone. And because of the lack of awareness, their friends, family, and even doctors don't understand what they're going through and may not even believe them.
Nausea and vomiting is very common in early pregnancy and occurs due to associated hormonal influences. It is unpleasant but does not put your baby at any additional risk and usually settles down by 16 to 20 weeks of pregnancy in most people, though in some it may persist for longer. So if you do suffer from nausea and vomiting in pregnancy, we do suggest a few changes to your diet and daily lifestyle that can help improve your symptoms. These include getting plenty of rest, as tiredness can make nausea worse. If you feel nauseous the first thing in the morning, then try to get up slowly. If possible, eat a toast or dry biscuit before you wake up. Eat small but frequent meals that are rich in carbohydrates and low in fat, like rice, biscuit, potatoes, crackers, etc. But keep eating and do not stop eating. Avoid very sweet and very spicy foods. Drink plenty of fluids, sipping them little by little, rather than in large quantities at one time. Avoid smells and foods that make you sick. Try to ask your friends and family for support during this period, as it is known to help. Taking ginger is also known to be beneficial during this period. Wear loose, comfortable clothing and stay happy. If these symptoms persist in spite of these measures, we recommend a short-term course of antiemetics that is known to improve these symptoms and is safe in pregnancy. Some women suffer from a severe form of vomiting in pregnancy, which is known as hyperemesis gravidarum. So you need to meet your gynecologist if you have very dark colored urine or do not pass urine for over 8 hours. If you are unable to keep down any foods or fluids for over 24 hours, if you have abdominal pain, if you have fever with a temperature above 100.5 degrees Fahrenheit, or if you vomit blood. In these situations, we require urgent hospitalization for intravenous fluid therapy and further medications. So do not worry. Though nausea and vomiting is troublesome in pregnancy, it can be managed by a few dietary and lifestyle modifications with support from family and friends and by medical interventions as and when required. Thank you.